All right, welcome everyone. Today we're going deep into the world of respiratory therapy.
That's right, a deep dive.
Yeah, and I'm super excited about this one because to prepare for today's episode, deep dive, we cracked open a college course syllabus
Oh, wow.
and some lecture notes too. So
Nice.
get ready. We're going to get into it. Whether you are studying for a class, maybe you're just refreshing your knowledge, or maybe you're just curious, stick with us. This is going to be good.
It is going to be good. Respiratory therapy is where we take this essential element of life, breathing, and then we look at how we can apply practical skills to help people do it better.
Yeah, and you know what's funny? I was going through these notes and I was like, okay, electronic medical records and documentation. Doesn't sound that exciting, but I was like, wait a second, this is like the foundation
Yeah.
of everything. This is important. And I was really surprised to learn that the Joint Commission, the ones that like make sure hospitals are following the rules and up to par, they actually audit these records.
They do.
So this is serious business.
Yeah, if a hospital was just like, forget the five rights, like if they messed up the meds or the dose or even the patient, oh man,
Yeah.
what a disaster. These checks, like making sure it's the right medication, the right time, that's what keeps patients safe. It's all about preventing errors.
I know. And I was looking through, and there are so many abbreviations on those medical charts.
Oh, yeah.
And it's like, at first, you're like, oh, that's just shorthand. But then you realize it's like a whole other language.
It is.
BD for twice a day, and for as needed. Did any of those abbreviations kind of like jump out at you when you were looking at the material?
And respiratory therapists, they're often the ones like right there in the thick of it, taking orders from doctors during a crazy busy shift.
Oh, yeah.
And pretty impressive how accurate they have to be under pressure.
It's like that game of telephone,
Totally.
but like high stakes telephone. Okay, so let's talk about oxygen therapy, because I was going through the notes and was just amazed by all the different types of therapeutic gases. Air, oxygen, carbogen, heliox, nitric oxide. Like, who knew there were so many options?
And they all have their own unique, characteristics, like how they act in the body and what they're best suited for.
Yeah.
It's not just about giving oxygen, it's about giving the right oxygen the right way.
And the safety aspect, like those color-coded tanks.
Oh, yeah.
And then the index connector systems. I laughed at the acronyms at first, ASPASDS. And then I was like, wait a second, these are life-saving systems.
They are.
Like imagine if you hooked up the wrong gas to a patient.
Absolutely. They're brilliant.
And I was also kind of geeking out about the formula for calculating how long an oxygen tank will last, like an actual real-world math problem with real-world consequences if you don't calculate that correctly,
Yeah.
It could be like a life or death situation.
Totally.
So I'm definitely keeping that formula handy. And we can't forget about all the different ways to deliver oxygen, right? We got low flow, high flow, nasal cannulas, masks. It's a whole world in itself.
It is. Like, think about the rule of fours with nasal cannulas. You can, estimate how much oxygen a patient's getting just based on the flow rate,
Yeah.
but it just highlights how those small tweaks can really impact someone's breathing.
It's true. I never really thought about all the expertise that goes into something as basic as breathing. And speaking of expertise, let's get to medication delivery, because this is where things get really cool for me. Like, how does medication actually get into the lungs? We're talking about medication delivery modalities now.
Right.
And let me tell you, particle size.
Oh, yeah.
It's everything.
It's like sending a package. You need the right size box to get it where it needs to go.
Oh, yeah.
So do you want the medication to hit the upper airways, the lower airways, those tiny air sacs? It all comes down to the size of the aerosol particles.
Mind-blowing, right. So we're talking MDIs with spacers, nebulizers, dry powder inhalers.
Yeah, it's a whole toolkit.
It is a whole toolkit to deliver those meds right where they need to go.
And each tool has its pros and cons, right? So like the Peri-LC Plus nebulizer, that one's designed to reduce medication waste,
Oh, wow.
which is a big deal when you're thinking about cost and effectiveness. And then you've got the Advair Discus, which is a dry powder inhaler that's like activated by the patient's breath.
Wow. So much technology going into these inhalers.
Mhm.
It's amazing. But it's not just about the tech, is it?
No,
Patient education is key.
it's like having a fancy sports car and not knowing how to drive stick shift.
Exactly. If someone doesn't know how to use their inhaler race, it's not going to do them any good.
Exactly. Respiratory therapists are educators just as much as they are clinicians.
That's so true. So picture this, right? A horse. And think about those massive lungs.
Okay.
That's what I thought of when we were talking about hyperinflation therapy.
Oh, interesting.
It's all about maximizing lung capacity, especially after surgery. So important.
Sustained maximal inhalation, they call it SMI for short, is basically a fancy way of saying, take a deep breath and hold it.
Yeah.
It's so simple, but it's a powerful tool to prevent atelectasis.
Oh, tell everybody what atelectasis is.
It's a collapsed lung, and it's actually pretty common after surgery.
And you know what I'm talking about here, right? The incentive spirometer.
Oh, yeah.
I feel like everyone has seen that at some point.
That little tube with the ball that you try to raise by inhaling.
Yes.
I love those.
I remember using one after surgery, and I was like, weirdly competitive.
It's gamifying breathing exercises. I love it.
It is. And I love how it gives you that visual feedback.
Yeah,
So you can like track your progress and stay motivated.
exactly.
Okay, let's talk about something that we all deal with, but maybe not the most pleasant topic, mucus.
Okay.
I know, but it's essential for a healthy respiratory system. But when it builds up,
Oh.
it can cause problems.
It can-
So airway clearance therapy. There are a ton of techniques to tackle mucus buildup. And some are so simple, like positioning your body to use gravity to help drain the mucus.
Yeah, and then there are more hands-on techniques like percussion and vibration.
Percussion, so like literally drumming on someone's chest.
Sounds a little strange, but trust me, it works. Loosens up the mucus so it's easier to cough up.
I like that. So then there are devices too, right? Like the flutter valve and acapella. Those use vibrations and positive expiratory pressure, or PE, to help clear those airways. Imagining it feels like a mini massage for your lungs.
Not quite a spa treatment, but they can be really effective for certain conditions.
Yeah, and then you have, like, for those more serious cases, there's intrapulmonary percussive ventilation, IPV. That one sounds intense.
It is. It delivers these pressurized pulses of air to break up that stubborn mucus.
Okay, so imagine that. Those air pulses just blasting through the airways, breaking up all the mucus.
A pretty good fit.
And then for those dealing with chronic conditions like cystic fibrosis, there's the high-frequency chest wall oscillation vest.
Yes, often called the vest.
The vest.
Yeah. Think of it as a wearable massage therapist for your lungs.
I like that.
It's so helpful for conditions like cystic fibrosis where the mucus is super thick and sticky.
So there you have it, folks. Airway clearance therapy, from ancient techniques to high-tech gadgets.
Yeah.
It really shows how dedicated people are to helping others breathe easier.
It does.
Respiratory therapists are heroes,
Absolutely.
battling mucus,
They are.
airway obstructions every single day.
I agree.
And that is just the beginning of
Yes.
our deep dive into their world. Stick with us. Prepping for this deep dive has really made me realize how much I take breathing for granted.
Yeah,
It's like literally the foundation of life.
it is.
Yet I rarely, if ever, stop to think about all those intricate mechanisms that make it happen.
That's the cool thing about respiratory therapy, though. It really highlights the miracle of breathing.
It does. And last time we talked about some pretty intense stuff, right?
Yeah.
Electronic medical records, oxygen therapy, medication delivery.
We did.
Now let's switch gears and talk about something that gives patients some control back. We're going to talk about controlled breathing techniques.
Okay.
And I was really surprised to learn how many different techniques there actually are
There are a lot.
and how much of an impact they can have.
Yeah, it shows how much power we have over our own bodies.
It does.
Sometimes just changing how you breathe can make a world of difference.
So true. Okay, let's start with manually assisted coughing, which is also known as the quad cough.
Okay.
This one seems really helpful for patients who might have difficulty generating a forceful cough on their own.
Exactly. It's like, giving your cough a helping hand.
Yeah.
So the caregiver will apply pressure to the abdomen as the patient exhales, and that simulates the mechanics of coughing.
Oh, interesting.
It's super effective for clearing the airways.
It sounds like a real team effort.
It is.
Okay, so now let's talk about the forced expiratory technique, or huff cough. This one seems a little bit more, forceful.
Think of it like clearing a foggy mirror with your breath, but for your lungs.
Okay.
You take a deep breath and then exhale forcefully with your airway open, and it makes this huffing sound. And that helps move the secretions up and out of your lungs.
That makes sense. It's amazing how something so simple like a huff can be so effective.
I know.
All right, next we have autogenic drainage.
Okay.
This one almost sounds like a meditation technique.
Yeah, it definitely has that mindfulness element to it.
Okay.
So the patient uses controlled breathing patterns to target different areas of the lungs, which helps gently loosen and clear secretions.
I love that idea. Using
Yeah.
your breath to heal yourself. Okay, and speaking of mindful breathing, there's pursed lips breathing.
Oh yeah, a classic.
This one is often recommended for people with COPD.
It's like resistance training for your lungs.
Right.
So by exhaling slowly through pursed lips, you create back pressure that keeps the airways open longer, which reduces air trapping and that feeling of shortness of breath.
So it's not just about how deeply you breathe in, but also how you exhale.
Exactly. It's about fine-tuning your breathing for maximum efficiency.
Okay, now this next one, diaphragmatic breathing. I've actually tried to incorporate this into my yoga practice,
Okay.
but I had no idea it had so many therapeutic applications.
It's all about like retraining your body to use your diaphragm correctly.
Yeah.
That's your primary breathing muscle.
Okay.
So many people just breathe shallowly from their chest, but diaphragmatic breathing really encourages that deeper, more relaxing breath.
I can see how that would be helpful.
Yeah.
Okay, so for those who might need a little extra help, there's the mechanical insufflator, exsufflator.
Okay.
That one sounds pretty high-tech.
It is. It's a device that can deliver an artificial cough. So it basically mimics the body's natural clearing mechanism. This is especially helpful for patients with neuromuscular conditions. They might have difficulty coughing on their own.
It's incredible what technology can do.
It really is.
Okay, so we've covered a lot here. From mindful techniques to high-tech devices,
We have.
it seems like there's a whole range of approaches to help people breathe easier.
Yeah, and these techniques aren't just for folks with, chronic conditions.
Oh.
They're helpful for post-operative recovery, pulmonary rehab, even just everyday respiratory health.
It's really empowering.
It is.
Speaking of postoperative care, let's talk about hyperinflation therapy. This is all about preventing and treating atelectasis,
Right.
which is a collapsed lung,
Yeah.
and that's a common complication after surgery.
Exactly. And sustained maximal inhalation, or SMI, is key here.
Okay.
Remember that horse with those huge lungs we talked about earlier?
Yes.
SMI tries to achieve that same level of lung expansion on a human scale, of course.
Of course.
And the incentive spirometer is like the perfect tool for that.
Oh, it's so cool.
Yeah, you get that visual feedback, and it motivates patients to take those deep breaths and keep their lungs healthy.
I love it. All right, let's get to the heart of airway clearance. Last time we talked about mucus.
Yeah.
And I have to admit, thinking about all that gunk building up in my lungs is not a pleasant thought.
I get it.
So let's talk about the heavy hitters in airway clearance therapy. Chest physiotherapy in all its different forms.
All right, so we're going to cover a range of techniques,
Mm.
and each one has its own way of loosening and removing that mucus.
Okay.
So you've got chest percussion and vibration, which are often used alongside postural drainage,
Okay.
and that uses gravity to help drain the secretions.
It sounds like a carefully choreographed dance.
It kind of is.
You position the patient just right to target specific areas of the lungs.
Exactly. And the percussion and vibration, it's almost like a rhythmic soundtrack.
Yeah, like drumming on the chest and back.
Yeah, it's super effective. Now, a trained therapist can do these manual techniques, but there are also devices that can provide percussion and vibration too.
Oh.
And if the patient can handle it, you can combine those techniques with positive expiratory pressure, or PTP,
Right.
that can help clear the airways even more.
PEP seems to be like the MVP of respiratory therapy.
It really is.
We've already talked about it with the flutter valve and the acapella.
It's a multi-purpose tool.
Yeah, it is. So PP therapy is when you exhale against resistance, which keeps the airways open,
Right.
and that lets trapped air escape, improves lung function, and makes it easier to cough up those secretions.
Exactly.
So many options. All right. And for patients who need a more intense approach, there's intrapulmonary percussive ventilation, or IPV.
That one's a powerhouse.
Yeah, it sounds like it.
It's a high-frequency, high-intensity therapy. Basically rapid bursts of pressurized air, and it also delivers a dense aerosol of medication or saline.
Okay.
So it's really good for loosening up that thick, sticky mucus that's hard to clear with other methods.
Imagine those air pulses just like blasting through the airways and breaking up all that mucus.
It's a great visual.
It is.
Now, for patients who have chronic conditions like cystic fibrosis, who often need airway clearance every day, the vest can be a game changer.
Right, the vest. That's the high-frequency chest wall oscillation vest.
That's the one.
It's that inflatable vest that rapidly vibrates the chest wall, helping loosen and move the mucus.
Yeah, like a spa treatment for your lungs.
That's a good way to put it.
It's gentle, but effective.
I like that.
And it can be used right at home,
Oh, nice.
so patients can manage their condition more independently.
Technology is amazing.
It really is.
It's constantly evolving to help people with respiratory conditions.
Yeah. From simple breathing techniques to high-tech vests, there's a whole world of options out there.
That's so true. And as research continues, I bet we're going to see even more innovative solutions in the future.
I think so too.
It's a really exciting time to be following the field of respiratory therapy. Okay, so we've talked about oxygen tanks, mucus busting techniques, so many different things.
Yeah.
But there's one more crucial piece of the respiratory therapy puzzle that we could explore.
Okay.
Humidification.
Right.
Now, I'll admit, when I think of humidifiers, I'm usually picturing like stuffy noses and dry winter air.
Yeah.
Not necessarily high-tech respiratory care.
Not the most exciting topic, but it's important,
Yeah.
especially for patients with artificial airways, like tracheostomy tubes. When you bypass the upper airways like that, the air that reaches the lungs is missing out on its usual warmth and moisture.
Right. So it's like those air sacs in the lungs are expecting a tropical vacation,
Yeah.
and instead they're getting hit with this dry desert air.
Exactly.
No wonder that can cause problems.
It can. That dry air can make secretions thicker, which makes it harder to clear the airways, and it can even irritate and damage the delicate lining of the lungs.
Yikes.
So humidification is all about recreating that tropical vacation,
Yeah.
making sure the air reaching the lungs is nice and warm and moist.
So in the materials, I noticed there were different types of humidifiers,
Mm-hmm.
passive and active.
Right.
What's the difference?
Okay, so think of passive humidifiers like a recycling system for your breath.
Oh, okay.
They capture the heat and moisture from your exhaled breath, and then they give it back to you when you inhale.
Oh, interesting.
Heat and moisture exchangers, or HMEs, are a good example of this.
Okay.
They're small, efficient, and great for short-term humidification.
That's pretty cool, like recycling your breath. It's like those little silica gel packets you find in shoe boxes, but instead of absorbing moisture, they're giving it back.
Yeah, good analogy.
Yeah.
Now, active humidifiers are more like adding a humidifier to your home.
Okay.
They directly add moisture to the air you breathe,
Okay.
and there are a few different types.
Right.
Bubble humidifiers, pass-over humidifiers, wick humidifiers, each with its own way of delivering moisture.
I'm assuming the type of humidifier used depends on the patient and what kind of respiratory support they're receiving.
Absolutely. So, for example, a bubble humidifier is often used with low-flow oxygen delivery,
Okay.
and pass-over humidifiers are more common with ventilators and high-flow systems. It's about finding the best tool for each situation.
Right. Right. There was this term that I came across, isothermic saturation boundary, or ISB.
Yeah.
What is that?
Think of it as the sweet spot for your lungs. It's where the air you breathe reaches the ideal temperature and humidity,
Okay.
which is body temperature and 100% humidity.
Wow.
And it's usually located just below where your trachea splits into the two main bronchi.
So above that boundary, the air is getting warmed up and humidified, and below it, it's already at that perfect state.
Exactly.
It's like a checkpoint for optimal breathing conditions.
It is. And in patients with artificial airways, that sweet spot moves higher up because they're bypassing the upper airways, which is where a lot of the warming and humidifying naturally happens.
Right.
That's why providing enough humidification is so important for them.
Makes sense. And I know we've covered a lot of technical stuff, but let's bring it back to the patient.
Okay.
Why should someone care about humidification? Like, what does it really mean for their experience?
Well, imagine constantly breathing in dry, cold air.
I don't even want.
It would be so irritating, uncomfortable, and it could even hurt your airways. Humidification is what stops those problems from happening. It makes breathing easier, and it supports your overall respiratory health.
So it's like the difference between walking through a desert and walking through a rainforest.
Yeah.
One leaves you parched and gasping for air, and the other is refreshing and like revitalizing.
That's a great way to put it.
And I imagine for people with respiratory conditions, humidification is even more important.
Oh, absolutely. It has loosened secretions, making them easier to cough up, and it reduces inflammation in the airways, which improves airflow and eases shortness of breath.
So it's not just about comfort.
No.
It's about improving lung function and quality of life.
Exactly.
It really is remarkable how something as simple as adding moisture to the air can make such a big difference.
It all comes back to air. We need it to survive, but we need it in the right condition to really thrive.
And that is exactly what we've been talking about in this deep dive.
It is.
We started with accurate record keeping. We explored all kinds of therapies and techniques, oxygen delivery, medications, breathing exercises, airway clearance, and now humidification.
Wow. We covered a lot.
It's really incredible how much knowledge and skill goes into helping people breathe better.
It really is. I mean, it's been a whirlwind tour of respiratory therapy, but I hope you've gained a new appreciation for this field.
I definitely have.
It's so important.
It's amazing how much we learned about breathing. And I know we've only scratched the surface,
We have.
but I hope this deep dive has sparked some curiosity and maybe even inspired you to learn more.
Yeah, I hope so too.
This field is constantly changing. There's new discoveries and innovations all the time.
That's true.
It's really exciting.
And who knows? Maybe you'll be the one to make the next big breakthrough.
Yeah.
The possibilities are endless.
So until next time, breathe easy, keep learning, and never underestimate the power of a good breath.
Great advice.